By the time a U.S. child is in middle school, he or she has seen 8,000 murders and 100,000 acts of violence. And if anything, we've seen only an increase in the amount of violence that children have seen. The term virtual violence replaces what we used to call as screen violence, which refers to violence and aggression that children see on a television or on a movie screen. That experience has changed dramatically now because children experience violence in computer games, on tablets, and increasingly with immersive technologies. Virtual violence has three primary effects on children. The first is that it can be scary, particularly for younger children. And we know that children who watch or experience virtual violence are at increased risk of sleep disturbance, nightmare, night terrors, early awakening. The second effect it has is it desensitizes children, and for that matter adults, to violence. The more screen violence they're exposed to, the less bothered they are by real-world violence that they see or experience. And the third and most disturbing effect is that it actually induces violence. First, pediatricians need to talk about children's media diets. Parents and pediatricians have to have very frank discussions about what their children are consuming. Second, parents need to be very mindful about what their children are experiencing in the virtual world. Third, we need as a society to promote legislation that provides caregivers and children with more specific and useful ratings. Number four, pediatricians should advocate for more child-positive media, making pro-social themes as important as violence and aggression. Number five, the news and information sources need to stop presenting the findings linking screen violence, virtual violence, with real-world aggression as if they're controversial. There is an overwhelming scientific consensus that that link is real and should be taken seriously. And sixth, the federal government has to become involved in making reliable and robust ratings that really assist parents in making wise decisions about children's exposure to screen violence.